gonna give me there we go. And I can chop it off if I need. Okay. Welcome. This is Maggie Holt, physical therapist from UVM Medical Center and proud member of the Falls Free Vermont Coalition. And
good morning. I'm Steele Taylor. I'm a neurologist and I'm the medical co-director at our memory disorders program.
that's great. Thanks for coming, Dr. Taylor. So can you tell us a little bit about what your practice is like and how exercise fits into that?
Sure. Thanks, Maggie. So, in my clinical practice, I am primarily evaluating patients with a question of cognitive complaints and whether or not there's an underlying condition such as Alzheimer's disease that is explaining the symptoms that they're coming in with. And, it is true that Alzheimer's disease is very common. It's the most common cause of dementia in individuals greater than the age of 65. And the general rule of thumb has been that there's no disease modifying therapies available to us in terms of therapeutics that we might prescribe.
You mean like medication?
Exactly. We have medications that are called cognitive enhancers that can be very helpful, but they are not felt to impact the underlying disease process. So with that in mind, there is actually a lot of compelling evidence that multiple lifestyle interventions, best used in combination together, can mitigate the severity of conditions like Alzheimer's, can potentially slow the progression. And there's even more compelling evidence to suggest that if these sorts of lifestyle interventions are initiated in mid to late adulthood, that many cases of Alzheimer's disease could potentially even be prevented.
Really?
Yes. So there's a lot more to come on that, but the major trials in regard to that last point are what's called the FINGERS study, as well as the US POINTER trial. So if you just remember pointer, finger, then you have a good foray into some of the literature on this. More specifically, the types of interventions that are utilized in these sorts of studies include physical activity. They also include cognitive and social activity. They include dietary interventions, and then they focus on sleep-based interventions as well.
So is that what you mean when you say lifestyle, those kind of categories of things?
Exactly. And, I really think that of those, exercise sort of lies at the core because it actually is related to sleep quality. And at least in pre-COVID times, there's a strong social element to exercise. Although I know that in your group, you guys have worked very hard to sort of work around that with some of the virtual platforms.
We're actually, I'm going to do a plug. We're doing exercise classes on Monday and Thursday during the month of February. So people can find that on Facebook.
That's excellent. And I actually participated a couple of months ago
in
one of the pushback virtual group courses, and I was surprised. It was a very good workout. So
we're stellar.
Enjoyable.
So can you give us some more of the specific ways that exercise helps?
Sure. I think, there's both the immediate as well as sort of the long-term benefits of exercise. I think that many people are probably familiar with the so-called runner's high, where exercise likely increases signaling related to certain brain chemicals, such as the endorphins or the well-popularized dopamine or dopaminergic system. Over the long term, there's a number of mechanisms through which exercise is probably protective for the brain and promotes cognitive performance. So just to kind of give a little bit of a rundown, we know that exercise, first of all, is very helpful for the vascular health of the brain. So just as it's good for the vascular health throughout the body and within the heart, it's also
in the way the blood pumps through the brain.
Yeah, in terms of the way the blood pumps and sort of the integrity of the blood vessels, their ability to dilate and constrict and prevent the
Mhm.
formation of stiffening or atherosclerotic plaques and things like that. And that's closely tied to cognitive function.
Sure.
We also find that exercise helps the brain to clear certain cellular waste products. Does so probably through a couple of mechanisms, one being improving the activity of what is called the glymphatic system, sort of the
Say it
brain's,
again, the lymph or
it's called the glymph, sort of the
lymph.
brain's equivalent of the lymphatic system.
Mhm.
And it also seems to promote the activity of what are called lysosomes within the brain. And those are sort of the cellular incinerators for waste products. And so there's probably that's probably one of the important mechanisms through
Huh.
which
It's like
exercise
taking
helps.
stuff out to the dumpster, getting rid of it.
Exactly.
Yeah.
Um, Also, it seems that exercise reduces
Mhm.
inflammation throughout the body and specifically within the brain. There are molecules that are referred to as myokines that are released from muscle, and those are also chemical signalers that can decrease inflammation. Um, and then it also seems that exercise reduces oxidative stress within the brain. And then finally, it also seems that exercise promotes the release of what are called neurotrophic factors. These sort of help to maintain neuron integrity or even stimulate what's called plasticity or the ability of brain cells to form new connections with each other. Um, we could continue on in
That's
terms of
quite an inventory.
some of
Yeah.
some of the mumbo jumbo here, but just to back up, I would say that if you look at the therapeutic the research pipeline in terms of developing the drugs of the future that will hopefully be used to help treat conditions like Alzheimer's disease, many of these drugs in development actually operate through similar mechanisms to
Mhm.
what we've just outlined in terms of decreasing inflammation, increasing neurotrophic factors, improving the vascular integrity within the brain. And so, why wait for these to come along when we already have this sort of an intervention available to us?
Yeah. With really little side effect, right? I mean, all the side effects from exercise are good. You get stronger. You might do it, get social, right?
It sounds too good to be true.
I know. I know. Remember that who said if there could be a pill, it would have everything that exercise has in it, right?
It would be $1 trillion pill.
Yeah, yeah. It's interesting the pieces about inflammation because a lot of times people are worried about inflammation in their joints when they exercise. So there's that balancing act about picking the right intensity where you're not going to inflame your joints, but you get that beneficial systematic inflammation. Are there other things you think people tend to overlook when they exercise?
I think one of the things that's overlooked, especially sort of in my patient population, is the importance of resistance and strength exercise to sort of complement aerobic exercise. We know that specifically there is a loss of muscle mass, also called sarcopenia, that can be seen in the early stages of conditions like Alzheimer's. And it seems that the sarcopenia progresses with worsening severity of the disease. We think that the degree of muscle mass that an individual has is actually probably a better predictor of their sort of longevity in terms of their functional independence, ability to be at home and care for themselves is probably a better predictor of that than things like cognitive testing, some of the silly memory tests it might feel like we do for people. So,
Wow.
I think that maintaining and even building muscle mass is very important across the lifespan, and individuals even later in life are fully capable of increasing or at least maintaining their muscle mass. And I think that is an important point of emphasis.
Yeah, yeah, I agree. I think that's a message that certainly has evolved over the span of my lifetime and my career. The amount of studies that show there is no reason to stop exercising, and there's every reason to continue exercising.
Absolutely.
It sounds like in your world, that's, that's really being played out on the molecular level as well as the bulk muscle level. Yeah. Well, that's great. I really appreciate you coming by and sharing all your knowledge and expertise. I know you're a busy guy. So thanks for taking time to help the coalition get the message out that it's time to warm up in February and then keep up with an exercise habit. Anything you want to close with?
No, that's great. Thanks, Maggie. And I really appreciate all the work that you and your colleagues do as we co-manage many of these patients. It's crucial work that you guys are doing.
Yeah, we have a great community and a great coalition and a good team. So thanks for being part of it.
All right. Take care, Maggie.
See ya. Bye. I'm gonna